Good evening, I'm Mike Wise. There's a new step from the province tonight to stop the spread of COVID-19 in Ontario's long-term care homes. 1 in 6 of them are now dealing with an outbreak of the disease. Now hospitals are being told to hold on to their elderly patients and put a pause on transferring them to a long-term care or retirement home. Angelina King has more.
Even with COPD, 81-year-old Irina Kazmarek can still blow out her birthday candles. Her daughter wants it to stay that way.
It's day 9 for her, so she's fighting with her life right now.
Her mother is currently battling COVID-19 in hospital. She's doing well, but Kazmarek is afraid she could get it again if she had to go back to her long-term care home. She's grateful the government is now telling hospitals to stop transferring patients to nursing homes, even if they were already in one.
The decision was made just because we're seeing the impacts of breakouts in long-term care homes. We know that that's a priority population that we need to protect. We want to make sure that we don't create any more new admissions because they're having difficulties dealing with their current residents.
More than 100 of the 626 long-term care homes in Ontario are dealing with COVID-19 outbreaks. While hospital capacity is an ongoing concern during the pandemic, a government memo says as of Monday, acute care capacity was at 64%. So it's believed hospitals have room to care for patients instead of sending them to nursing homes. Kazmarek says she doesn't want her mom going back to West Park long-term care home.
I believe she was neglected, even going in to see if she's still alive, and that wasn't happening.
Kazmarek says there was one instance when a nurse entered her mother's room without wearing a mask. She also doesn't think her mom was taken seriously when she asked to go to the hospital last week, so Kazmarek took her herself. That's where she was tested and found positive. If she hadn't taken her,
because with what she's going through with her COPD, I don't think she would make it.
West Park says protection and safety of residents is priority and that the home is taking all necessary measures to limit the spread of COVID-19. It also says family members' concerns will be investigated. The government memo says if this new directive causes any sort of capacity issues in hospitals, then staff should contact Ontario Health. There's no date set for when transfers will start up again. Angelina King, CBC News, Toronto.
We're learning tonight that a personal support worker at a long-term care home in Scarborough has died due to COVID-19. The woman in her mid-50s worked at Sienna Altamont Care Community near Port Union and the 401 in Scarborough. In a statement, Sienna Senior Living says, "Today we received the difficult news of the passing of a much-loved and valued team member from Altamont Care Community. She will be sadly missed by all of her colleagues and by residents she cared for." Well, tonight we spoke to the head of the union representing 60,000 frontline healthcare workers in Ontario, and she did not mince words.
The government has got to take control of this. I don't know how many deaths it's going to take for this government to step up. The Premier says every day that he has placed an iron ring around these homes. It's far from an iron ring. It is a plastic mesh, and tonight it just busted open with a really big hole in it.
And we're learning tonight of some other gaps in the province's new plan to stop the spread of COVID-19 at long-term care homes. The plan to limit staff to working with just one home won't actually start until next week. Many of those workers tell us more needs to be done to protect both them and their residents. Lisa Shing has that story.
There's a lot of anxiety in the homes every time a resident is getting swabbed. We've had people crying in the parking lot.
This Port Hope nursing home worker says she hasn't seen her grandchildren since the pandemic started.
We are at such a high risk with contact, and you know, we're giving up so much more than I think the government realizes.
That's why she wants better protection, especially for those who have to piece together work at different locations.
And we will spare no expense to keep our most vulnerable people in long-term care safe.
Even though the province is stopping staff from working at multiple locations, the new order doesn't apply to retirement homes nor temp agency workers.
We needed a group that could be able to provide the safety for our residents in long-term care through shoring up the capacity of staffing.
The province says nursing homes will be screening those staff closely. The order also doesn't take effect for another week.
That gradual time over a span of a week was to allow the homes to adapt so that they were not left without staff.
Then there's the issue of pay. In British Columbia, all part-time workers are now paid full-time wages. In Ontario, officials are looking to the federal government.
I think we need support for our frontline healthcare workers at long-term care on wages. It's very simple.
The federal government is looking at ways to support the provinces as they deal with this issue. We're discussing pay top-ups for people who work in those situations because the conditions are getting more and more difficult.
The federal government has just expanded eligibility for the Canada Emergency Response Benefit. Those making less than $1,000 a month will now qualify, and essential workers like those in long-term care homes making less than $2,500 a month will see some kind of pay boost. Those details will be worked out between Canada's premiers and the Prime Minister in a call tonight. Lisa Sheng, CBC News, Toronto.
Another resident of that Markham home for adults with physical and developmental disabilities has died from COVID-19. Patricia Baird passed away yesterday after testing positive for COVID-19 on Monday. She'd lived at Participation House for 5 years. Her brother wrote a tribute to her on Facebook, saying, "I cannot describe the pure love and heart that our universe could not contain that was within Patty. A large part of my life's direction and worldview comes from my relationship with Patty over the many years." Now, Baird is the second resident of Participation House to die. Barton Frogley died yesterday. Earlier this week, the home announced that 37 of 42 residents have tested positive for COVID-19. 12 staff members are also infected. Participation House has been short-staffed for more than a week. An employee who spoke with CBC News says some staff called in sick over concerns for their own safety. She says employees who asked for protective gear were told it wasn't required by ministry regulations. Now, Participation House is now receiving support from the Markham Stouffville Hospital. And Markham Stouffville Hospital received a donation of 10,000 N95 masks today, a number of which are going to be going to Participation House.
This is an amazing gift, something that our workforce can ultimately use every single day, and it's such a generous donation to the hospital and to Participation House as well.
The masks were donated by Click Health, which has donated over 300,000 masks to hospitals and healthcare systems across the GTA during the pandemic. Well, some good news in the fight against COVID-19. Many Ontario hospitals say they haven't yet seen an expected surge of patients, but experts say the ones they do have are posing a different challenge for intensive care units. It's how long those patients are typically staying. Lauren Pelly explains.
Toronto hospitals aren't overflowing with COVID-19 patients, but clinicians say the ones who are heading to intensive care units are severe cases, staying far longer than the norm. On average, patients typically spend 3 days in Canadian ICUs, but multiple critical care doctors told CBC News COVID-19 patients are often staying a week or more.
And so that does have large implications for resources.
This physician and professor says when patients pile up, it puts strain on equipment and ICU teams.
Because it's not just a question of counting patients and how many, come in requiring intensive care. It is that multiplication out of how many days they're needing an ICU bed and a ventilator, because that's what sort of adds up and stacks up.
Another big challenge for clinicians treating COVID-19 patients is even some of the severe cases can need vastly different supports. Some patients just need oxygen, others need to be hooked up to a ventilator, and some have such great inflammation their blood pressure starts to drop.
Suddenly now we have a whole unit full of these sicker, unstable patients, so it's requiring more care from both a nursing and a physician standpoint.
While roughly 250 COVID-19 patients are currently in the province's ICUs, those numbers have been trending downward over the last week, keeping units below their current capacity. Physicians credit those extra beds to thousands of postponed surgeries and weeks of physical distancing. That means we can't breathe easy just yet.
very unclear what the right decision is or what the right timing is in order to start easing some of the stay-at-home restrictions.
Lauren Pelly, CBC News, Toronto.
We have an update to a story we brought you last night about those bus drivers who walked off the job at the TTC's Queensway division. They were protesting a lack of personal protection equipment during the COVID-19 outbreak. Today, the Ministry of Labour ordered them back, deeming their work refusal unwarranted. The TTC says so far 19 employees have tested positive for the disease, including 5 bus operators. Drivers today saying they bring their own supplies but are still anxious.
When there's no one on the bus yet, you might feel safe. But when there's crowds and you try to prevent it, obviously, right? But sometimes you just can't. TTC should be providing us 100%.
I've got my own anyway. It's not very good, but it's better than nothing when I decide to put it on.
The TTC said in a statement that precautions are in place to protect drivers, including plexiglass shields, gloves, sanitizers, and rear door boarding. The transit operator is hoping to have washable masks to distribute within the next couple of weeks. And the Toronto Zoo says it is feeling the crunch from COVID-19 and is now looking for help to keep feeding its animals. The zoo relies on parking and admission fees to help feed its 5,000 animals. That costs about $1 million a year. To make that up, it is now fundraising with the Toronto Zoo Wildlife Conservancy and reaching out to the public. And we are starting to get word tonight of some local bars being forced to close their doors because they can't make rent this month. That comes as the federal government announced a new plan to help small businesses pay the rent. Natalie Collada has the details.
With his salon closed for the last month, Char Diab has been practicing his craft on his kids. It may be cute on social media, but the state of his business isn't.
For the first time in my life, I'm actually scared and terrified and stressed and, on the point of mental breakdown because the worry and the butterfly in my stomach, how can I provide for my family? How can I sustain my business?
The Oakville salon owner has been closed since mid-March. There's no money coming in, but lots going out. He's reached out to his landlord, but
there is no rent forgiveness. You have to pay the rent or everything in the lease will be enforced. And yes, you will, if you cannot pay the rent, basically you're in default. And then the landlord have the right to terminate your lease and lock your door.
Today, the federal government announced a plan to try and help small businesses like his with rent.
We're announcing our intention to introduce the Canadian Emergency Commercial Rent Assistance Program for small businesses.
And this program will provide loans and forgivable loans to commercial property owners who will in turn lower the rent for their small business tenants for the months of April, May, and June.
And that's help 34,000 businesses across Canada have said they need. They have signed a petition asking for a pause on April rent, further wage subsidies, and debt deferrals for both commercial tenants and landlords.
According to our numbers, 70% of small businesses who have signed up for our petition will not make May 1st rent.
And businesses like Diab's hope help won't be far behind.
It's all I think is about business, how I'm going to survive.
Natalie Collada, CBC News, Toronto.
Well, if not a haircut, grocery shopping is probably on your to-do list for this weekend. But can you do it safely? Our Ali Chasson offers up some tips after the break. Plus,
well, we've got about 36 hours or so to get through where the temperatures are still going to be running below seasonal, and then a warm-up will be coming. I'm meteorologist Colette Kennedy. After the break, I'll have all your details also about a system that's going to pass by just to our south tomorrow. What will the impact be?
It's time to welcome meteorologist Colette Kennedy with her forecast. Now, after all the flurries I saw today, Colette, I'm looking forward to a warm-up this weekend.
Yeah, Mike, you know what? I think we're all in the same boat. So many of us looking forward to the temperatures at least getting back closer to seasonal. And it is coming, but in the meantime, we have to deal with them still running about 5 degrees below. And that's for the overnight lows and the daytime highs. 36 hours and then things improve for us. We do have a pretty significant storm, though, that's just kind of skirting to the south. So we'll see it kind of brush through and have a bit of an impact on the GTA. And then there it is. We will see sunshine coming along with that warm up as we go into Saturday. Now, overnight tonight, -3. It's going to feel cooler than that, like -8. Tomorrow, some isolated flurries is how it's looking, but certainly a lot of extra cloud cover coming through. 6 degrees for us. The wind's not as strong as what they were today. The system that I'm talking about, you can see it here coming out of the Midwest as we go into the early morning hours on Friday, starts to bring in some mixed precipitation, then some light wet snow into southwestern Ontario. A closer look by lunchtime, it's coming around, having an impact on the Niagara Peninsula. Likely it's going to skirt by there towards Hamilton, Burlington. You'll feel the impact, London as well. The GTA, if it just stays on this track, it just kind of skims right to the south. So we see a little bit of flurry activity, but primarily it's just the cloud cover to deal with. Now, areas where we are going to see things picking up a little bit of accumulation, I'll show you what to expect, but I do just want to show you, pause here for a moment, the setup for Saturday with high pressure building in behind the system. That's why we're going to get into some sunshine. So back towards the Windsor area, 5-6 centimeters certainly possible there on this particular track. Hamilton, St. Catharines, you may pick up 1 to 2 centimeters, and you can see at this point not putting accumulations into the GTA, just a little bit of a dusting or some flurries flying for us. Overnight tonight, the temperatures for southwestern Ontario, -2, so running again below seasonal, around 4 or 5 degrees, and we're seeing mostly cloudy skies, and then you get into that wet snow. It's probably going to take till tomorrow evening before it's all out of the way, although it will get lighter in nature, and that's why your temperatures are held down to highs just around 2 degrees for there. And overnight tonight in the GTA, -3, -4, partly cloudy. Most of those scattered flurries kind of die down, and then tomorrow afternoon things change up again. You can see the cooler readings. You'll be lucky to get 3-4 degrees here, where we're going to have that precipitation pushing through, and should be about 6 degrees with the afternoon cloud cover elsewhere. Saturday, though, with that sunshine comes the warm up, bouncing back to seasonal. 11 degrees for our high, 12 degrees on Sunday, but that's when the next system kind of works its way through too. So bringing some showers for the second half of the weekend, Mike.
Okay, thank you, Colette.
The weather update is brought to you by Train, the most reliable heating and cooling brand. We test, so it runs. Take advantage of special offers now. It's hard to stop a train.
Before this pandemic, heading to the grocery store was pretty straightforward, but these days it can cause anxiety and concern. Now, to be clear, you don't need to wipe down your products afterwards, but there are steps you can take to keep yourself safe. Ali Chanson has some tips.
At CBC Toronto, we've been getting lots of questions about whether it's safe to go grocery shopping. And the answer is yes for most of us. So let's break this down so that we can understand how to keep ourselves safe. It's a good idea to make a shopping list and plan for a week's worth of meals so you don't have to keep going back to the store. When you can, go alone. The fewer people inside the store means the less risk to everyone. Physical distancing, physical distancing, physical distancing. If you have to wait outside while the store limits the number of people inside, do your best to keep 2 meters apart. Coming at off-peak hours will help reduce the amount of time you spend waiting in line. Wipe your cart handle or your bin handle because these are the surfaces that people touch the most. And remember, no touching your eyes, no touching your nose, no touching your mouth, no touching your face. When you're inside the store, do your best to be patient and keep the distance between yourself and other customers. And that may mean waiting to go down an aisle so that the people ahead of you can get what they need off the shelf. And only touch what you're going to buy. Now is the time to maybe eyeball that avocado for doneness instead of touching all of them. It's also worth just taking a few seconds to express some gratitude to these grocery store workers who are doing a great service for us, keeping us fed and healthy. Hey, Jason. Thank you. At checkout, be mindful. Give your cashier as much space as you can. You're a bit freer to move around, whereas they're sort of stuck standing in the one spot. And paying by tap is preferable for the both of you instead of handling cash. Thanks. Once you leave the store, now is a good time to sanitize those hands once again. If you can afford to shop online and have your groceries delivered to your door, that may be the safer option. It just reduces the amount of time you spend out in public. But the downside is some of these delivery apps have huge backlogs on orders, so you could be waiting a while to get your groceries. There is the option of ordering ahead and picking them up at the store. Most experts agree that you will not get COVID-19 from your groceries packaging, but you can always give them a wipe if it makes you feel better. As for your fruits and veggies, go ahead and wash them as you normally would. If you have symptoms of COVID-19 or are over the age of 70, then no, you should not be going out to grocery shop, nor should you be going outside right now. If this is your situation, reach out and ask for help. If you know someone in this situation, reach out to help.
Coming up, why are Austin Matthews and Ryan Reynolds video chatting in Christmas sweaters? I'll tell you why after the break. Without any hockey to keep him busy, you might wonder what Toronto Maple Leafs alternate captain Austin Matthews has been up to these days. Well, we know what he did today, at least. The superstar teamed up with Canadian actor Ryan Reynolds, virtually, of course. to answer some questions from patients at Sick Kids Hospital. Take a look.
Hello, who's this?
This is Tanika. I have a question for both of them.
Perfect.
The reason why you guys have so much facial hair, is it because of COVID? You aren't shaving and you have nowhere to go or to meet people?
I have facial. He has a very handsome facial furniture going on right now. I don't have as much. This is just what I don't know what.
I've been doing this for all season, so I mean I can't really. It's pretty easy to just take this off, but I wish I could grow a beard like that. I mean, I'd probably look a little bit better.
My wife Blake is here.
Oh, by the way, they were wearing those Christmas sweaters because of the Sweater Love campaign, which helped raise over $300,000 for sick kids over the holidays. And of course, it did snow today, so it was appropriate. Well, car enthusiasts from across the Windsor area have been teaming up to put a smile on people's faces during this pandemic as well. Snow in Windsor as well. A number of people who are stuck celebrating their birthdays at home because of COVID-19 got a little surprise. A lineup of cars honking their horns, helping make their celebrations memorable. And today, another car cruise, this time classic cars for healthcare workers at Windsor Regional Hospital, thanking them for all they are doing during this pandemic. That's our newscast for tonight. Tomorrow on The Current, Matt Galloway looks at a crackdown on disinformation related to COVID-19. Canada is considering whether to follow a British proposal to make it illegal to spread disinformation for fears it could put lives in danger. You can hear that conversation just after 9:30 on CBC Radio 1. I'll see you back here tomorrow night at 11. Good night.